So we covered our crystalloids, our colloids, we covered our blood products, and the major electrolytes. Let's talk about the nursing implications. We want to start with our assessment, right? Assessing the baseline fluid volume and the electrolyte status of our patient. That means we might take a look at their chemistries. We might take a look at their CBC. We want to be sure we have baseline vital signs and that our assessment has included skin, mucous membranes, daily weights. Daily weight is the #1 indicator of fluid volume changes. Intake and output are important for us to measure and monitor. Before we would give any potassium, we want to make sure that the patient has had an ECG and that's been assessed. We would assess for contraindications to the therapy. We want to know about their transfusion history. Have they ever had a transfusion, and have they ever had a transfusion reaction? We also want to be sure that we assess them for cultural and religious beliefs if we're planning to give a blood or blood product. We may establish venous access as needed depending on your facility policy and your training. That's not something that's in your general LVN program, but there is LVN IV insertion courses that are usually available in most states after you have your license. Those regulations are very clear on what the LVN can and cannot do in terms of administering types of fluids. Typically, LVNs can assist with administering blood and blood products, but they cannot start those blood or blood products, only do the vital signs and monitoring. And that's going to vary from state to state. While we are monitoring fluid and electrolytes or giving therapy for this, we would monitor their serum electrolyte levels. We're also going to monitor infusions, the rate, the appearance of the fluid or solution, and the site. That site is to be observed for infiltration or other complications associated with IV therapy, such as infection. Parenteral infusions of potassium must be monitored closely. IV potassium must not be given at a rate faster than 10 milliequivalents per hour to patients who are not on cardiac monitors. For critically ill patients on cardiac monitors, rates of 20 milliequivalents per hour or more may be used. But we never give IV potassium as a bolus or undiluted. Never, ever. It is one of the 3 medications that is used in a lethal injection, and it is used in that situation to stop the heart, which is what it will do when you give an IV bolus or you give it undiluted. So put that in your brain and keep it there. We never give potassium IV bolus or undiluted. Oral forms of potassium must be diluted in water or fruit juice to minimize GI distress or irritation. So we're going to monitor for complaints of nausea, vomiting, GI pain, or GI bleeding. We administer colloids slowly. Remember, they have a protein in them, and we don't want to cause a rapid fluid shift. With all of our fluids, whether it's crystalloids, colloids, or blood products, we always want to monitor for fluid overload and possible heart failure. For blood products, we follow administration procedures very closely. Typically, blood products require 2 licensed nurses verify the blood's type and cross-match and that it matches the patient's blood type. So we also monitor more closely with the vital signs while administering blood and blood products. Just be sure you know your facility policy for that. We're going to monitor closely for signs of transfusion reaction. Often, transfusion reaction and blood transfusion starts with the patient complaining of low back pain. So make sure you know the signs of the transfusion reaction. We are going to continue to monitor for the therapeutic response. It's important as a nurse that you know the normal lab values for the red blood cells, the white blood cells, hemoglobin and hematocrit, and those electrolyte levels, so that when you are monitoring your patient who has had an abnormal lab value, you know what the expectation is that they will reach. We want to look for signs of improved fluid volume status. That's going to be changes in our skin. It's going to look less dehydrated. They're going to have moist mucous membranes. They're going to be more alert. They're going to feel better and an increased tolerance to the activities. And then, of course, we want to monitor not just for the therapeutic, but also for any adverse effects. So, you know how to get a hold of me. Feel free to email, text, call, or post in the discussion forum. We'll talk to you soon.